Hello, everyone. It is my distinct pleasure to welcome you to the third annual Instruction to Industry Virtual Career Expo event for high school students. My name is Bonnie Wannette. I will be the moderator for the Health Science Industry Panel discussion tonight. I am the Senior Academy Specialist in the Office of CTE for Fairfax County Public Schools. I would like to express my sincere appreciation to the industry professionals for taking your time tonight to share your diverse perspectives on the current and future workforce in health science. We encourage you to take advantage of this opportunity to learn from the panel. Hopefully, after leaving tonight, you will feel more knowledgeable and prepared for your post-secondary future. The format of our session is it's going to run from 4 o'clock to 4:45. We will start with introductions and then get into the conversation. During the session, you are encouraged to share your favorite moments and what you find interesting on social media using the hashtag #InstructionToIndustry tagline. At the end of the webinar, a link to an exit survey will be sent to you. This survey will provide you with the ability to share your feedback on the panel discussion. Please make sure to stay until the end to ensure that the survey link is sent to you. All right, so we are going to get to it, and our discussion consists of 5 amazing panelists with diverse background in the field of health sciences. Each panelist is going to begin by introducing themselves with a brief introduction. Okay, so we will start with Lee. If you want to go ahead and introduce yourself.
Hi, everyone. I'm Lee Guarinello. My role is Director of Community Health Programs at Inova's Community Health and Health Equity Division. So I've been with Inova for 20 years. My background is public health. I have a master's in public health. So I'm not a clinician. We have some clinicians with us today. I do more community engagement, community connections, and health equity work. And this is Gogo, and I'm sorry that she's interrupting me.
No problem. We love those introductions with the pets too. We will now go with Dr. Jeannie Charles.
Hi, my name is Jeannie Charles. I'm a pediatric emergency physician at Inova Loudoun Hospital. I work for Commonwealth Emergency Physicians. I've been with Inova for about 25 years and with Commonwealth Emergency Physicians for 18 years. I'm also the chair of the Department of Pediatrics at Inova Loudoun Hospital and the medical director of the Inova Loudoun Concussion Clinic.
Thank you, Dr. Charles. Arzu, would you like to introduce yourself?
Thank you, Bonnie. My name is Arzu. I am a pharmacist with Giant Pharmacy, and I also take care of their clinics off-site. So we provide vaccines and health screenings to companies and organizations in Maryland, Delaware, Virginia, and DC.
Thank you so much. Aubrey, would you like to go ahead and kick things off for you?
Thanks, Bonnie, and it's nice to be here with you all today. My name is Aubrey Weber. I am a technical officer at FHI 360, which is a global health and development organization based actually out of Durham, North Carolina, but we have offices all over the world. Our organization kind of touches all of health and development from the programmatic side. So from health, nutrition, research, technology, youth, crisis response, economic development, education, environment and climate change, we're touching it all. I personally work on an HIV prevention project called Mosaic, which is geared towards adolescent girls and young women, and is a global project based in sub-Saharan Africa. And I work primarily on the communications and knowledge management side of that project.
Oh, thank you so much. And last but not least, Heather, would you like to introduce yourself?
Hi, I'm Heather Ross, and I work for FHI Clinical, which is sort of a daughter company of FHI 360. Our niche in that global systems health thing is assisting developing nations to have the clinical research infrastructure so that, the next time we have one of these global pandemics, they can do their own research and have their own priorities and hopefully not have to wait for the rich countries to finish up their doses of vaccine before they can have their own doses of vaccine.
Wow. Wow. Okay. Thank you. It looks like we definitely have a diverse group to discuss some great things tonight. So we're so excited. This next part is going to consist of different questions that I will throw out for you guys to answer. 1 to 2 minute answers. That way we have time for plenty of discussion and Q&A. So we will go in the order that is on the screen. And the first question that I have is, well, what is your favorite part about working for your company? And what is the hardest part? So a little 2-part action. And Lee, if you'd like to kick it off.
Sure. So what I love about working for Inova and working in the roles that I've worked in, I worked at the Inova Juniper program, which is HIV services, Aubrey, for 15 of my years at Inova, is that there's never a dull moment. I think that's true in lots of aspects of healthcare, but particularly with community engagement and health equity. Every day is different. You know, this is not part of my typical day doing presentations with students, but then there are days I talk to 6th graders and days I am giving tours to 12th graders, and then days where I'm completely out in the community working with homeless individuals and things like that. So it's always interesting. It's always exciting. That's also what's hardest, is that sometimes you have a day where you just want to, just sit. I'm going to sound like a nerd, but there are days where I just want to sit in front of an Excel spreadsheet and do analyses, just mess around with some Excel. And I don't get that opportunity often enough because there's so much exciting stuff going on.
All right, Dr. Charles, would you like to answer the question?
Sure. My answer is very similar to Lee's. As she said, in the healthcare field, I think that's why a lot of us go into healthcare. What makes it my favorite part and my harder part are both the same. It's the fact that every day is different. I get to help people that need help the most at extremely stressful time in their lives. I never know what's coming in the door. So I could be sitting having a coffee at 10:02, and at 10:05, I'm saving a life. And at 10:15, I'm running around playing with some children in the unit that aren't terribly ill. And at noon, I'm doing a procedure. So my every day is different. I never know what to expect when I get up and when I walk into work. So that's what makes it both my favorite part and the hardest part.
I like that. Sometimes those are the 2 things that go together. The hardest part is the part that you like the most. So thank you. Arzu, would you like to answer?
Sure. I think it's very similar to what the other panelists mentioned. But I do want to say that my role has a lot of flexibility. Sometimes I can get up at 10 a.m., sometimes I'm up at 4 a.m., depending on the season, which is also a good and a bad thing. So when we do clinics on site, we administer vaccines, for example, the flu shot, to communities all around in the area. So we do it for the airport, for example, and airport employees, they have a set of different schedules. So I used to be up at 4 a.m. Giving them, flu vaccines. So I would be at the airport by 4, that is, and then I would wake up at like 3:30. And then off season, which is current, I can get up at noon if I wanted to. And, the day goes by pretty smoothly. So.
Wow, that could be a little hard to get adjust to your sleep schedule, I would think. All right, Aubrey.
I love this question. So my favorite part of working at FHI 360 is probably because I am project-based. I get to work with people all over the world. And the people I interact with on a day-to-day basis are from, many different regions. They bring a lot of expertise to the table. And it's a privilege because I feel like I can learn so much from them and their experiences. So that's my favorite part. The hardest part is probably FHI 360 is a organization that's about 5,000 global employees. So I think one of the hardest parts has been to find my specific niche and my footing. I think this is probably particularly hard for people who start working now in like kind of a remote environment. I fortunately have been around long enough that I was a pre-COVID employee and had that in-office experience. But I think that is something that I've also heard has been a challenge for people coming into their career for the first time in a virtual environment.
Yeah, I think a lot of adjusting, like in every company, I think we hear that like the pre-COVID employees and then the post-COVID employees. So it's a different perspective for sure. Heather, if you would like to answer the question.
The absolute most joyous part of my job is that I never have a problem answering the question, but what can I do about it? The people who work in global development and who work in medicine and healthcare in general know that there's a mission, there's work to be done, and we can actually do something to affect change. The hardest part is seeing sometimes how slowly that change comes and how challenging the change can be when it seems to make so much sense, and then sometimes it's just harder than it seems to be.
Gosh, okay. Thank you guys all for those perspectives. It's certainly really worth it for students to hear, like, there's obviously parts in our career that brings us joy, but there are also those struggles, but mostly makes it worth it for the joy that it brings you. So thank you. This is actually one of my favorite questions I'm about to ask because I was a former high school career specialist. So we talk a lot about transferable skills. So, meaning like what would make them employable in this career and beyond? What are the things that transfer and are applicable to all careers? So Lee, if you'd like to kick that off.
Sure. So skills is kind of the question, right?
Yeah. Yeah, and
Okay.
skills that make you marketable in this industry and or other industries.
Gotcha. So like I said, my background is public health versus medicine. So a lot of the skills in our arena, we're hiring for my counterpart who has moved on to another wonderful role at Inova. And so we've had to recently articulate what are those skills? And it's amazing how complex it can get, but because we do data analysis, we do, like I said, messing around with Excel spreadsheets and trying to take feedback from surveys done in the community and assess what the community need is. But then we also have to be able to articulate that back. And I think that's a big part of public health, that is it on a community level. I think in medicine and in direct healthcare clinical work, you have to be able to communicate to an individual. In my work, it's about communicating to communities and communicating to stakeholders and elected officials and things like that. So you kind of need the hard data skills, but also the soft communication skills and the hard writing skills. But then all of those skills about diplomacy and flexibility, whenever you're working with stakeholders, with community members, we don't all see eye to eye. We all don't have the same perspective or life history, the same social drivers of health. So probably listening is one of the most important soft skills that our team needs to have.
Yeah, thank you. We hear so much about communication, but not just communication, like who are you communicating with? So like taking consideration, who is your audience and what are you trying to effectively communicate? So that was a really good one. Thank you. Dr. Charles?
Again, like Lee, there are some skills that are necessary in medicine that are transferable to other fields. A big one is communication. In medicine, you have to deal with so many different people, different ages, different backgrounds, different races, different languages. So, throughout the day, in a period of seeing 20 to 30 people, I've had to deal with people that speak different languages, that are young, that are old, that are, hearing impaired, that are a variety of different ways that I have to learn to communicate. And then listening is a very big part as well. So I think those skills are transferable. Sometimes people don't actually say what they mean, or they don't say why they're there. Sometimes they're direct, and sometimes you have to figure out what somebody really wants from you and how you can really help them. So that's definitely a skill that would go from career to career. I know that I had to work very hard and had to make lots of sacrifices to get where I am, in terms of really loving what I do, because there's a lot of training involved and a lot of missing out on holidays and evenings and weekends and sporting events. And, when I was younger, events with friends, and I was older, events for my children or for my family. So the training is hard and the training is long, and you really have to want to do it. So, but being able to focus and being determined and knowing what you want, knowing that what your goal is, will help you in any career or field. It's definitely a marathon and not it's definitely a marathon and not a race to go into medicine. So it takes a long time. In terms of skills in medicine, it's very different. There's so many different aspects of medicine, from patient-facing fields to fields that involve looking at material or having IT experience. There's so many different pathways that you could use to go into medicine. So I think those skills are transferable in a variety of different fields as well.
Well, thank you for sharing that. And we're really grateful for passionate practitioners like yourself. So I know had the training and we could get into that part, but do know that it is long and there are sacrifices. So motivation is definitely key in, I would say, most careers, but especially this one. Arzu, would you like to answer the question?
I think Dr. Charles touched a lot of what I was going to actually say. I had given a lecture on respiratory viruses to some employees at the airport. There are about 200 of them, and so it's kind of like a learning experience. They learn from me, and then I also learn from them. And one of the employees had a presentation, and he said, the one common denominator about all careers is people. And that really resonated with me. So no matter what career you ultimately go into, you're working, I want to say for people, but in a good way, meaning you're sacrificing a part of your life to make theirs better, especially in the healthcare field. So as pharmacists, we do come day to day to, piggyback off of Dr. Charles with individuals with language barriers, for example. So we have to accommodate to them. The other thing I want to say that's a very transferable skill in general is confidence. I think I have a background in psychology, and I think sometimes going into certain work fields or workforces really challenge our ability to maintain that confidence throughout when we're outside of our comfort zone. So as students, and I was just a student back in 2020. I graduated from pharmacy school then. So I think one of the things that I learned going through school and just in my work field was to maintain that. And so if someone tells you you can't, your ultimate job is to prove them that you can. So I think that's a really big transferable skill that I think everyone should have.
Oh, wow. I really love that one. Confidence. I love that. Thank you. Aubrey.
These answers have taken all of mine.
We might need
But-
to go the other
and
way.
Heather is still behind me.
Yeah.
But yeah, I'm trying to think from like the young professional. I'm not a young professional quite anymore, but I did start at my company as an intern right out of school. So things that I was thinking back helped me the most that are absolutely transferable skills are, as many people have mentioned, being a really strong communicator. And that even goes to, if you are stuck and you have absolutely no clue what you're doing, communicate that to your mentor or your supervisor or whomever. Don't hold on to that. Learning is part of any job. So, trying to, if you're struggling to communicate because you don't want to admit that you're, struggling or just need more help, that's not going to help you in the long run. So strong communication, also staying super organized. I mean, transferable skill to any job, but also to life. If you have a lot on your plate, if you're an organized person, you can usually manage that in a way that will not overwhelm you. And of course, if you are overwhelmed, being a strong communicator and being able to say that you are to someone that can help you with your workload is helpful. And then also just something I was told when I was first starting out in the field was say yes and have an openness to trying new things and learning new skills so that eventually you can say no to those things that you don't want to do, and you can find your niche, and you can yeah, I'll just leave it at that. I think that was really helpful advice when I was first starting out.
Oh, that's really great advice. Okay, Heather, last but not least.
I'm ditto. I have to get really down to the details on this one. When we say communicate, please learn to write.
Mm.
Write cohesively, learn where the commas go. You would not believe how many doors it opens if you have a well-written resume. Even if you are at the beginning and you don't know, if you can speak and write in clear, concise language, you're going to get more feet in the doors.
Wow, this is such good advice. I'm really glad that it's recorded because there's just so much good content to summarize for students. So thank you guys for that. Okay, so this is a good one. What are some common misconceptions about your industry or field? So about your work, the industry in general, about health sciences. So you could speak about your own part of the career, but also in general about health sciences. Okay, so we'll turn back to, you know what, actually, let's switch it up. Let's go with Heather, if that's okay, because, you know, we can then go backwards.
Unfortunately, in the last 2 years, the answer to that question in clinical research has really very much changed. All of them.
All of them.
Much misconception. And my advice is, and this is not just in epidemiology or clinical research or anything like that, it's in everything in life. Question everything, find good sources for the answers, question again, find more good sources, and you will come to the right conclusions.
I like that. Question everything. That's good stuff. All right, Aubrey, misconceptions.
This is a tough one. I think the only thing that comes to mind for me is that, and I don't really think it's a widely held misconception, but that, you know, people in global health feel like they have all the answers. That's not, I think that's a small one that I hear about sometimes, and that's not absolutely not the truth. This is why we do research, this is why we collect data. We're an evidence-based organization. So I think it's like kind of a weak misconception, but it is one that I have noticed.
No, I think you're spot on when we think about the last 4 years. I mean, people look to the people who are doing to be like, why don't you know? You know, like, so it is evidence-based and you have to wait for the evidence and you have to question it. So all very spot on. And this misconceptions couldn't be more timely with the kind of work that you guys are doing. All right, Arzu, misconceptions in your world.
I think as pharmacists, we have quite a bit of misconceptions. People normally think that the only thing we do is dispense medication and just work behind the counter of your average CVS or Walgreens or Giant. But we actually do much more than that. We look at the clinical side of medications. So we look at drug-to-drug interactions. So if you're taking more than 2+ medications, we're analyzing to make sure that there's no problem. We look at allergies. We administer vaccines. What is it? I guess I can use myself as an example. I also do global related work, actually, like some of us over here. So I travel abroad very frequently, and I am attempting to establish a nonprofit pharmacy in South Asia. And so, pharmacists go beyond the scope of just the nation. They help just beyond the means of, the mortar and pestle concept of pharmacy. So you can probably ask your pharmacist over your doctor about your medications or your vaccines, just as, and I think some people don't know that. So we do have heavily clinical-based education, not just taking pills and putting it in a bottle.
No, that's actually something that I didn't learn until I had kids myself. Like pharmacists are educators and they do like to take the time to, talk to you about your questions and your medicine. And like, so I talk to my pharmacist, like, just like say, hi, like we are like, I feel like we're friends. So I love that you brought that up because I feel like a lot of people do think that they're just filling the prescriptions, which is so much more to it. Thank you. All right, Dr. Charles, misconceptions. Oh, I think we are on mute, Dr. Charles. We can't hear you.
Hello, sorry.
Thank you. No problem.
No, I was just saying that some of my thoughts were the same as some of my colleagues on this call as well. But one misconception is that healthcare professionals are motivated by financial gain. That's a big thing for doctors, and overlooking the fact that we have a genuine dedication as a group towards like helping people and towards a patient's well-being. And it's not about the financial gain. Other misconceptions are that doctors know everything. So I'm going to piggyback on what was said earlier, and that especially in the emergency department, I find that a lot of people will come to the ER when they're frustrated. They've been to a couple of other doctors. Now they're going to go to the ER because the ER is going to give them an answer. So that's frustrating sometimes because, medicine is a constantly evolving field and we don't have all the answers. We collaborate a lot with other healthcare professionals. We collaborate with the pharmacists. We collaborate with the researchers. And we're constantly trying to care for a complete person by collaborating with other people in our field. So I think the big misconception is that we know everything and that we're in it for the money, but not at all.
No, I'm really glad you brought it up because I don't know that I've really met one student that is motivated and thinking the career health sciences that isn't like a helper by nature. Like that's to the core, like they care about people and they're a helper. So that's a really good point. All right, Lee, last but not least, misconceptions in the industry.
All right, I can totally copy and paste all the misinformation, disinformation stuff. One of the ones that I have a lot is that healthcare is nurses and doctors, period. And that the way we talk about healthcare, health systems, hospitals, it's basically a city. When we talk to sixth graders, which I know this group is not is not in middle school, but we often say like, what are you interested in? And, drawing and, whatever, a million different answers. And for any answer they give, there's something in healthcare that fits it. There's architecture to be done in hospitals. There's engineering. It's across the board. So I think that's the important thing is that healthcare is almost anything you can do could fit into the healthcare bucket.
That's a good perspective too. I'm really glad we're having, this is discussion on careers and establishing like what is out there. So it's a really good point to bring. Okay. So in your opinion, what is the single most important thing students can do when thinking about pursuing a career in the health sciences field? You've covered some of this, but if you had to zero in on one kind of area, what would that be? And then we'll go back to Heather for this.
Think broadly. It's exactly right, Lee. Healthcare, health systems, healthy lives, healthy communities. There's so much out there. So think about who you want to help, how you can contribute, what you do well, and find something that fits you within this career.
I like that. Think broadly. All right, Aubrey.
I think one of the most important things for students to keep in mind going into health sciences or any field really is building a network, especially when you're super young and your job is school and whatever else that entails. If you can simply, find someone that's doing a job that you're interested in and ask if they'd be willing to talk with you. The answer is almost always yes. And just building a network of people who now know you by face and name and know what you're generally interested in. You never know who in the future will help you get that job. And I have had my own experience at FHI 360. I found someone that I thought had a cool job title on LinkedIn, didn't know them at all, didn't even live in the state. And I cold messaged them, and that person ended up being my first supervisor at my organization, which is really awesome. So it can work and it does work. And I think just building a network, not even, this is even before you are looking for a job or an internship or anything like that. You can do that now. You can do that at any time. And again, you don't know who will be helping you in the future. So it's always good to have a strong support system behind you.
That's such a good point. And you brought in like the LinkedIn part, and it's just like not being afraid to network and not being afraid of that no, or like that potential no, because you just don't know where it's going to come back and full circle, and you just never know who you're going to meet along the way. So it's a really great point. Arzu, do you like to offer up single most important piece of information for students?
I think thinking outside of the box is really important. When you go into health sciences, it becomes very textbook-like. So you start reading books and you think that there's nothing technically that can be outside of this. So everyone's scenario becomes different. So if you become a doctor, not everything is textbook, or in the pharmacist world, we see certain situations where people respond to medications differently, and we have to think outside of the box. Ultimately, when you think outside of the box, you're specializing yourself and individualizing yourself. And I think one of the most important things that can make you stand out is just being you, and really not narrowing yourself to just standards of procedures, for example, and saying that that's it. And that's something that I learned from a really hard failure in pharmacy school, where someone actually told me, who was my superior, that the reason you weren't accepted for something was because you don't fit the criteria of what we're looking for. But ultimately, it actually worked in my favor, because now it's actually helping me develop a path that a lot of people have turned to me for in pharmacy. So it's something that you should always keep on proud as on your back, saying that you are who you are, and not forgetting that.
Oh my gosh, that's really great advice. Dr. Charles.
I think one of the most important things is to gain some hands-on experience through internships, through volunteering or shadowing healthcare professionals, because I think this helps confirm your interest and gives you a realistic view of the field, like the day in and the day out of what going into that field involves. And it'll help you make a better decision about whether or not it's the right career for you earlier on, and then having to figure it out later once you put your foot in the door.
That's great. It's great advice. And if I know the students that are probably on here, these are probably students that are absolutely would be open to having an internship, and probably maybe even reach out to some of you and find you on LinkedIn. All right, Lee, if you would like to.
Dr. Charles stole one of mine. I think, and I will say, what I was going to say is test drive what you think you're interested in. And I think internships, shadowing, those are the best way to do it. But I also, from an equity standpoint, I recognize that's not accessible to everybody, especially since most internships can be unpaid. If you can do it, fantastic. But if it's watching YouTube videos about what it's like to work in that role, if it's just like Aubrey was saying, or digging around on LinkedIn and seeing if someone will have a half an hour chat with you who does the job. I think we've seen, probably lots of us have seen folks who want to be a nurse, mom's a nurse. Now I'm trained as a nurse, and then realize I don't really like patient facing work. And then that takes me to the second answer that I was going to give, which is careers are not straight lines. That some people have straight lines, and I wouldn't even say they're fortunate to have straight lines. It's not one is better than the other. I know tons of people who had amazingly successful clinical careers and then decided to switch gears and do something else entirely, sometimes in the healthcare field, sometimes somewhere else entirely. And I will say that the folks that I've worked with who have diverse backgrounds, maybe they did marketing and then switched over to government relations and then they got their nursing degree. Those folks tend to have the best perspectives on things, which I'm not one of those folks. I had a pretty, not exactly straight line, but I have a boring, straight line-ish career. And I look to those folks who have done different things in their careers as some of the most thoughtful folks around getting different perspectives on the work we do.
That's really good advice. We hear that constantly, like there is no necessarily a straightforward line to getting into your career, and that's okay. So I think sometimes students think, well, if I follow this path, it's going to lead me here. And so it's a really good reminder for our students. Okay, so this one, you guys probably would expect this question. What's the one thing you wish that you knew or done or experienced when you first started in your career field? And we'll go with Lee again. We'll go start back to the beginning.
Okay. I'm gonna give an example. So I went from high school straight to my undergraduate degree in biology and anthropology to my master's degree in public health. And I remember very vividly in my master's program, you got to choose your courses. I know someone asked what classes to take. And there was a course on like program development, budgeting and design and things like that. And everyone icked it. We were all like, oh, budgets. I'm here for the good of all and the whatever, who cares about budgets? And literally 6 months into my job, my boss left and they were like, Lee, could you handle like managing these budgets? And I was like, oh no. And then within doing it for maybe a month, I was like, I love this. I never would have thought about it. And I think it goes to something someone said earlier is like play around and explore different aspects of all of the work. I never would have dreamed that I to this day, I manage a ton of budgets. I love doing the accounting. I love all of that. It's a small part of my work, but it gives you a whole different perspective. It's creative. Creating budgets is creative. So be careful if you're someone who thinks you're not technical. Don't let that get in your way. If you're someone who thinks you're not creative, don't let that get in the way of what classes you take. Try to take a few classes or a few subjects that are outside of your comfort zone, because you might discover that they're completely things that you would love to add to your portfolio.
I love that advice. All right, Dr. Charles.
I'm going to piggyback on Lee now. I was thinking some of the same things. I know that I had a straight line. I always knew I wanted to be a physician and I was going to take science classes and I was going to go to medical school and then I was going to be a doctor. But, you know, I didn't do as much of some of the other things like IT, computer work, like everything overlaps these days. So it's one of those things where I found myself, you know, as an older physician, I started doing everything on paper and then all of a sudden everything became computerized and everything became an electronic medical record, everything. And I wish I had more IT background or more IT experience back when I was going into medicine and thinking, I don't need to know these things. I don't need to know about, you know, I don't need to type very well. I don't need, now everything involves a computer, typing, IT, integration of diagnoses and integration of everything in general. And then I think that's the biggest thing. That is the biggest thing even as I think about transitioning out of this career into another that still involves healthcare or medicine, I wish I'd had more IT background because that's where the world seems to be going right now. And I wouldn't have known that 25, 30 years ago.
I know, I was just going to say, I mean, technology is no matter what the career, it seems to be technology is, we need to be open to learning it because we're preparing our students for careers and we don't even know what the technology is going to exist. So that's a really, really good point. Arzu.
Sorry, could you repeat the question, Bonnie?
Yeah, so it is one thing you wish you'd known, done, or experienced when you first started your career.
I think the concept of not giving up, just like emotional support is really important from like a very general standpoint, minus the networking, you know, minus like the more sophisticated aspects of it, but just the concept of knowing that you have support and that, you know, don't give up in the most difficult times, because ultimately health sciences is a very difficult area, despite, you know, whether you're a doctor or I don't know, statistician or whatever it might be in health sciences, but knowing that, hey, like I'm able to do this, that's really important, and not being bogged down with the amount that you have to get done. So just from a very, I guess, like simplistic standpoint, I would say just not giving up would be a really good statement to provide to students going into it.
I like that. All right, Aubrey.
That was kind of mine as well. I love that we've just been all piggybacking on each other. I guess that means all of the answers are quite strong and correct. I think one thing, maybe that I knew all along, but one thing I wish I had reiterated to myself at the beginning of my career is that failure or not doing a task well is really an opportunity to learn and grow. When you look at people you admire in the fields you're wanting to go in, leaders, directors, whomever, and you're wondering how on earth did they get there and how do they know everything about everything? they also had to fail forward many times and probably continue to do so. I'm sure most leaders would admit to that. So just having grace with yourself and realizing that times where things might be particularly challenging for you, really those are great moments to embrace growth and becoming better at your skill set.
I would totally agree that a lot of leaders say that. That's absolutely true. So I would echo that. All right, Heather.
On top of everything else in the dittos, be humble. Lee, I actually teach program planning and program design at a public health master's degree. And the first day of class, the first thing I tell my students every semester is, we're doing this wrong. What we need from you is to help us do it just a little bit better. We'll still be doing it wrong, but then the next group will do it just a little bit better. So understand that humility is not about saying you're bad at stuff. Humility is about saying, yeah, we can get better at this.
All right. Well, like I said, I'm just so glad this is recorded because, you know, we can use this for students that weren't able to join and just really echo the great advice that you guys have given tonight. And we're just so appreciative. And thank you to those who had answered some of the questions in the chat. And we really just have about 4 minutes left. If anybody else would like to add anything very quickly, last minute thoughts.
I got one.
Okay.
A lot of people are asking about internships.
Yeah.
Internship or not, find a place to volunteer where you can help someone. The Red Cross, your local animal shelter, the library. Get into helping as a volunteer job. It looks good on your college resumes, but moreover, it lets you know how to work with people. And working with people is what this is all about.
I love that.
To take that very similar, Heather. One of the prompts that we had looked at was about social media and LinkedIn. Full transparency, I believe, I'm not sure even anymore, but I was always advised as a hiring manager not to look at social media except LinkedIn.
Mm-hmm.
So I don't really have any advice on what to do about all your other social media. But when it comes to LinkedIn, one thing I'll say from the community perspective, and I think this ties into what Heather was just saying, I have a lot of folks, I'm interviewing folks for director positions, so they've been in their career for a long time. And one of the biggest mistakes I remind people about is that they drop, once they become a leader, like a manager or whatever, they drop that frontline work off their resume. We're always told to keep our resume short, keep them tight. The stuff Heather's talking about, having worked in a library, you know, having like given back to your local, whatever it is, 4-H club or cooperative extension or whatever. When I'm looking at someone for a community health role, that's what I want to see. Like, I'm great. You're a manager. That's super important too. Don't get me wrong. But I want to see that you care about your community. I want to see that you've done direct helping. So I would say don't hesitate. I know as high school students, resumes can be intimidating because you may not have a lot of career stuff. Put that stuff on there. Use LinkedIn. It'll build up as you go, but put that stuff that doesn't feel real, I'm going to medical school. What does having, worked at the community pool have to do with anything? Well, you were a lifeguard, you were helping people. That's safety, that's health. So I don't know that every hiring manager would agree on that, but that's my perspective is if you can craft your statement around why this was about helping and why this was about the community, that's what I want to see.
That's great. I heard a lot of, in general, health sciences, you guys talked a lot about the people, the community, the helping, that feeling that you guys have all gotten, the joy that it brings. So I'm really just very grateful for your perspectives tonight on this panel. We would like to thank you for providing those unique perspectives as related to the workforce in health sciences. We hope you found tonight to be informative and relevant to your own career interests for the students. Students, you should remember that if you are interested in learning more about any particular career paths that we discussed during the session, you can come to the Career Exhibitors Fair on on Thursday and speak directly to our employers. Again, we'd like to thank our panelists so much for joining us this evening. This will conclude our session. And when we do close out our Zoom, there's a brief exit survey that will launch automatically when we close it. So thank you guys so much. And this will conclude our event tonight.
Thank you, Bonnie.
You.
Yeah, thank you.
Thank you.
Thank